Hello everyone, and welcome to the Animation Therapist channel. I'm glad you're there watching. I have no doubt that you will find this episode helpful and educative. I will like you to watch to the end, because I have lots of beneficial information to share in this episode. In the previous episode, we explored what personality disorder is, and highlighted the 10 major personality disorders, after which we focused on borderline personality disorder. In this episode, our spotlight will be on paranoid personality disorder. Let's do a quick recap of what personality disorder is all about. A personality disorder is an enduring pattern of inner experience and behavior that deviates substantially from the expectations of the individual's culture. This inner experience and behavior is pervasive and inflexible, has an onset in adolescence or early adulthood, and is stable over time, and leads to distress or impairment. Most of the time, persons afflicted with a personality disorder commonly perceive themselves, other people, and events around them differently than viewed by others, whereas non-disordered persons have fluctuations in their perceptions of themselves. These fluctuations are influenced by their relationship with events and other people. Non-disordered persons also recognize and acknowledge emotions and behaviors that are not consistent or appropriate for particular events and generally control themselves accordingly. Persons afflicted with personality disorders also have difficulty regulating the level of their emotional responses to events. They will either under or over respond. Their range and intensity of emotional responses are also apt to change. In this episode, our focus will be on paranoid personality disorder. We will explain the notable signs and symptoms, and also explore the possible interventions. People with paranoid personality disorder often have this widespread and deeply ingrained lack of trust that permeates their relationships or environment. These usually result in such individuals questioning the motives of others. They are hesitant to collaborate or cooperate, and also assume the worst about others' actions and decisions. Individuals with this disorder usually assume that other people will exploit, harm, or deceive them, even if no evidence exists to support this expectation. They suspect, based on little or no evidence, that others are plotting against them, and may attack them suddenly, at any time, and without reason. Individuals with this disorder are usually preoccupied with unjustified doubts about the loyalty or trustworthiness of their friends and associates, whose actions are minutely scrutinized for evidence of hostile intentions. A practical extreme example could play out in them accusing their partner of cheating, despite reassurances and proof of faithfulness. It is so interesting that some individuals with paranoid personality disorder get so amazed when a friend or associate shows loyalty that they cannot trust or believe it. If they get into trouble, they expect that friends and associates will either attack or ignore them. Individuals with paranoid personality disorder are reluctant to confide in or become close to others because they fear that the information they share will be used against them. For them, compliments are often misinterpreted. Let's take, for example, a compliment on a new acquisition that is misinterpreted as a criticism of selfishness. Or a compliment on an accomplishment, which they may misinterpreted as an attempt to coerce more and better performance. They may view an offer of help as a criticism that they are not doing well enough on their own. Individuals with this disorder persistently bear grudges and are unwilling to forgive the insults, injuries, or slights that they think they have received. Individuals with this disorder may be pathologically jealous, often suspecting that their spouse or sexual partner is unfaithful, without any adequate justification. They may gather trivial and circumstantial evidence to support the jealous beliefs. Individuals with paranoid personality disorder are generally difficult to get along with, and often have problems with close relationships. Their excessive suspiciousness and hostility may be expressed in overt argumentativeness, in recurrent complaining, or by quiet and apparently unresponsively hostile. Because individuals with paranoid personality disorder lack trust in others, they have an excessive need to be self-sufficient and a strong sense of autonomy. So most times, they are not positively responsive to help and support. They may be perceived as fanatics and form tight groups or friendships with others who share the paranoid belief systems. The possible causes of this disorder are usually multifaceted. I will list about 5 possible risk factors. 1 is the genetic factor. A positive family history of mental disorder in the family could increase the risk of paranoid personality disorder. So genetic predisposition may play a role. Another risk factor is brain chemistry. This has to do with imbalances in neurotransmitters like serotonin and dopamine, may contribute to paranoid thinking and behavior. The third risk factor I will mention is environmental factors. Growing up in an environment with high levels of conflict, violence, or instability can foster a sense of hypervigilance and mistrust. Also, societal and cultural influences that play out in terms of norms that emphasize suspicion, distrust, or persecution can contribute to the development of paranoid personality disorder. Another notable risk factor is the psychological component. Components such as cognitive bias and insecure attachment personality traits can all contribute to paranoid thinking. Also, social learning, which is observing and imitating paranoid behavior in others, such as family members or peers, can shape an individual's behavior and attitudes. Children may observe and imitate parents' paranoid behavior, such as constantly suspecting others of wrongdoing or overreacting to perceived slights. Parents who struggle with emotional regulation may pass on this difficulty to their children, leading to increased stress and paranoia. The final risk factor I will mention is traumatic events. Experiencing traumatic events, such as physical or emotional abuse, can lead to the development of a paranoid personality as a coping mechanism. Interventions for managing paranoid personality disorder may include psychotherapy, which entails cognitive behavioral therapy, psychodynamic therapy, and group therapy. The cognitive behavioral therapy helps individuals identify and challenge negative thoughts patterns and behavior. The psychodynamic therapy has different forms, but it is centered on exploring underlying emotional conflicts and childhood experiences that contribute to paranoid thinking. Group therapy will help the individual foster social skills, empathy, and trust and create a platform for role play. Medication is also a form of intervention for people with paranoid personality disorder, coupled with support groups, collaborative care, education and awareness, and sometimes family therapy. I believe you found this video educative and enlightening. If you have any questions regarding what has been discussed in this video, you drop them in the comments section or send an email to the contact provided in the description. Thank you for watching and engaging our videos. If you're yet to subscribe, kindly do so. We look forward to expanding our community and ensuring that our mental health awareness campaign get to more people. Thank you all. Cheers.